One of the questions I get asked frequently is about the safety of Brazilian butt lifts. In Miami, this has gotten a lot of press. We know that since 2010, there's been 25 Brazilian butt lift deaths, and 23 of them occurred in what we call budget clinics that are basically offering very low prices. Many of them are not board certified plastic surgeons. Some of them aren't even board certified at all. They offer very low rates and they do 7 to 10 a day. We know that 23 out of the 25 deaths in Miami occurred in these places. Guess what? Some of them were board certified plastic surgeons. So just because you go to see a board certified plastic surgeon doesn't automatically mean that these people are very good at the procedures that they're doing. That does imply a certain amount of training to teach some safety, but mistakes will still occur with lack of experience, even in board certified plastic surgeons. That being the case, I will tell you all of plastic surgery is very dangerous in inexperienced hands. It doesn't matter if you're board certified or not. At least a board certified doctor will take care of you and admit you to a hospital to take care of you versus a non-board certified doctor. It doesn't mean that the results are going to be good or that there's a guarantee on the outcome. That is up to you to do the research to determine that. So for safety for Brazilian butt lifts, we know that the problems occur when we inject into the muscle or below the muscle into large veins where the fat can travel to the heart and cause death. So really we've been taught, and we know that these deaths are caused by that, and we're supposed to be injecting the fat above the muscle, which means that we may not be able to put as much fat in certain patients because we have certain compartments, and when we fill that compartment, it's done. That being the case, the problem is that most plastic surgeons just don't have that experience level to know where their liposuction cannula is when they're doing liposuction or doing fat injections to make sure they're in the correct layer. They're trying to mandate ultrasound so that you can look and see. I will say that may be helpful for inexperienced surgeons. For surgeons like myself who feel like we know where that tip is all the time, that technology will add nothing for me. In fact, that just becomes a burden, really. And for those doctors who aren't really interested in safety and just budget clinics and high volume of money, they're just going to snap a quick picture, show that it was above the muscle, and then continue doing withdrawal, re-inject. They may be in the muscle, they may be below. So it's not going to really change anything, in my opinion. At the end of the day, we need to make sure that our surgeons are board certified. We need to make sure that they receive appropriate training. Experience is really what's going to determine it, guys. There's been a lot of liposuction deaths. In Missouri, there's been several liposuction deaths from board certified plastic surgeons. They get into the bowel, they're injuring bowel, they don't know where the cannula is. It takes thousands of surgeries to get that amount of experience, all right? Thousands. And unfortunately, a lot of plastic surgeons may never reach that number in that career, let alone the first 10 years. So make sure that your surgeon is doing a lot of whatever you are desiring. If they're doing a lot of Brazilian butt lifts, like for example, I may do 200 to 300 a year, then I'm gonna have a higher level of experience and training than somebody who does not. And the risk of these adverse events occurring is gonna be much less. The last thing is, remember, Brazilian butt lift is about shape. It's not about size. Just like breast implants, it's about shape, not size. We can make it about size if we want to. So if we recommend a Brazilian butt lift to you, just remember, we're not trying to make things just big. We're trying to use a Brazilian butt lift to shape through liposuction and through fat injections, through addition and subtraction to get you the best result. Keep those things in mind.